An ECG or electrocardiogram is going to allow us to look at the electrical conduction of the heart. So we've gone through what the intrinsic conduction system is. Now it's time to figure out, how do we measure that? How do we monitor that? So that's what an ECG is, or an EKG, maybe you've heard that. Every red dot you see here is going to be a lead position. So a lead is placed here on the skin with a wire heading back to the machine. The machine, or the electrocardiogram, is going to record all the electrical impulses from every one of these leads. It allows us to create a tracing of the electrical system of the heart. And this is what usually shows up. This is what you see coming out of an electrocardiogram. This is your ECG. What you'll notice, we have three main kind of protrusions from the line. We have the P wave, we have this QRS, and then we have this T wave. So we have to go through what each one is. The P wave is symbolic of atrial depolarization. It's the start of when the atria are being depolarized. That means it's the start of when the atria are going to contract. This correlates to the SA node. We'll show that in a second. So P wave is the initiation of atrial depolarization. QRS complex, that's going to be the initiation of ventricular depolarization. Just the very start of when the ventricle starts to depolarize at the apex. And then the T wave. The T wave is going to be the start of ventricular repolarization, or when the ventricles start to relax. And I keep saying the start of because none of these three things occur like that within a moment. They take a little bit of time. And if you're thinking, hold on, atrial depolarization, ventricular repolarization. What happened to the atrial repolarization? Atrial repolarization is hidden or masked underneath this massive QRS complex. So there's a much larger electrical footprint from the ventricles that create the QRS complex, while the atria, when they're repolarizing, we have a little blip, much smaller. So it's masked or hidden below the QRS complex. The other two parts we're seeing are this PR segment and this ST segment. Now, the PR segment is going to be just the space in between the two waves, from the P wave to the QRS complex. During that point, that's when the atria are going through their full contraction, pushing the blood down into the ventricles. The ST segment, that is when the ventricles have started to contract and keep contracting to be able to push the blood out into the vessels. So the actual segments, your heart is still contracting, just the atria first and then the ventricles. So let's try to correlate these to the intrinsic conduction system. So we'll start here. And I'm going to put this up full screen just because it's a little easier to see. What you're going to see here is there's a little bit of a purple tone at the end here. That is showing we've finished one heartbeat and now we're going to start a second one. So that means the start is the SA node. The SA node has depolarized, and notice there's a little bit of purple around it. That purple is symbolic of depolarization, which is why this P wave is also purple. It's showing the very initial, very start of the depolarization or contraction of the atria. Then you notice at this point, the entire atria are all purple. That is full depolarization or full contraction. That's why the PR segment here is now purple, because that's showing the atria are contracting. From there, we need to get the signal down to the ventricles. So notice that we've started right here, and that needs to then head down. So from the actual AV node, we're traveling down the AV bundle, down the bundle branches, and ending down here in the apex. That is your QRS complex, which means we've just started to cause depolarization of the ventricles. or start or initiate the contraction of the ventricles, because we start in the apex. Which then you notice the apex is a little bit darker purple. That's because contraction is pushing this direction, pushing upwards. It's trying to push the blood out through the pulmonary trunk, out through the aorta. But notice the ST segment is now purple, because as the ventricle keeps contracting, that's holding contraction all the way through the ST segment. Which then finishes off at the T wave is now purple. If you're thinking, hold on, this is all still purple. Yes, because remember, we've just started the actual repolarization of the ventricle, which means the whole set of both ventricles are contracted. And because both ventricles are contracted, they need to help and relax. That's the repolarization. So we're getting back to repolarizing, allowing everything to go back to rest. So that pretty much is how this whole cycle, this ECG, from the P wave to the QRS to the T wave, correlates to the intrinsic conduction system. So let's look at some ECGs that aren't quite normal and how this can help someone identify what's going on. In this first one, we're looking at a second-degree block. Notice how there's a P wave that's not followed right here. You'll see P wave, and then QRS. The idea is, with a second-degree block, not every P wave will initiate the full sequence, go to QRS and T. So in a second-degree heart block, you can see this as it's not always going all the way through every time. Atrial fibrillation. Look in between the big spikes, which are the QRS. You'll notice all this kind of like up and down. That's the atria fluttering, very quickly contracting. Not the way you want it to be. Not forming a proper P wave into the QRS complex. We have ventricular tachycardia. Tachycardia means an elevated heart rate. More specifically, an elevated heart rate that doesn't match the age or match the physical exertion. For example, if someone's 30 and they're sitting in a chair, but all of a sudden their heart rate is doing 180, that's not what you want. That's tachycardia. Now, this one particularly is ventricular tachycardia, which means the ventricles are the ones that are going very quickly. You'll notice how you're not even really seeing P waves, just ventricle QRS, over and over and over. And that's not even a proper QRS complex. We then have ventricular fibrillation. Now notice you can't even see a P wave, a QRS complex, or a T wave. Just it's not there. The ventricles are constantly contracting in an uneven rhythm. And third-degree heart block. Notice how infrequent you actually get a QRS complex. Your P waves aren't even standard here. You're trying to get that whole heartbeat, but it's just not working because the heart is being blocked. You cannot send the signals through. So that's a third-degree heart block. So a couple examples of how these ECGs can help a clinician understand what's going on in the heart itself. Now, these are some pretty extreme examples, but even more subtle ones. Maybe the ST segment was a little bit longer or too short. Or all of a sudden the P wave is a little taller than normal. They all can tell something about what's occurring in the heart and how that electrical conduction is working. So ECGs, electrocardiogram, the ability to be able to monitor what's occurring in the heart and that intrinsic conduction system.